Hello, everyone. The title of our presentation is Meaningful Engagement of Experts with Lived Experience in Healthcare Research.
This session is presented by Rose Kalemba and myself, Preeti Panda. Through this presentation, we will discuss our call to action, a brief overview of common health research methodologies, funding considerations, and case studies. We will also present a set of worksheets we developed to go with this presentation, which will be helpful for both experts and researchers when navigating meaningful engagement in healthcare research.
My name is Rose Kalemba, and I serve a number of roles within my various communities, and I'm a person with lived experience of being trafficked.
My name is Preeti Panda. I'm a pediatric healthcare provider, and I've been engaged in anti-trafficking work for over 10 years. Engagement of experts with lived experience in anti-trafficking initiatives is recognized as a best practice across a variety of sectors and is advocated for as a best practice by survivor-led organizations. Our call to action for all of you today is that researchers in health-related fields should seek to meaningfully and responsibly engage individuals with lived experience throughout the research process to improve the impact of this work and maximize mutual benefit. Health services research is a broad term referring to how various factors, including societal, socioeconomic, structural, historical, technologies, and behaviors affect health and well-being. Research on human trafficking in healthcare often falls under this umbrella of health services research. More specifically, types of research that you may encounter related to human trafficking in healthcare can be classified as public health or population research, implementation science research, clinical research, and policy research. Within each overarching type of research, investigators first create a research question or research questions, and then choose what type of research method will be the best to answer their question. Research on human trafficking in healthcare can span all methodologies and can include quantitative research, qualitative research, mixed methods research, reviews, and other types of peer-reviewed research. We would like to emphasize that any type of research study can incorporate meaningful engagement, even quantitative studies, which have historically not involved meaningful engagement of experts. Quantitative research generally involves results that reflect tangible numbers. It is well suited to ask questions related to how many and how much, but is in no way limited to these types of questions and can be applied to many research questions. Analysis in quantitative research usually involves applying statistical tests to the numbers related to the outcomes. Qualitative research generally involves results that cannot be easily distilled down to a number and are more descriptive. Qualitative data includes results from open-ended interviews, observations, and media, including photos and videos. Qualitative research is well suited to ask questions related to why something is happening, but again is in no way limited to this and can be applied to a broad set of research questions. Analysis in qualitative research usually involves identifying and trying to understand major themes from the data. Mixed methods research intuitively involves a study where the resulting data includes some quantitative information and some qualitative information. An example is a survey study where some questions have numeric answers, for example, a Likert scale rating from 1 to 5, that can be analyzed quantitatively, and some questions that are open-ended and seek long answers, which can be analyzed qualitatively. Systematic reviews and meta-analysis are studies that look at research that has already been published. One overarching research question is created, and the existing published research is searched. Data is compiled across these published studies to help answer the research question. These studies can involve qualitative and quantitative analysis. There are many existing systematic reviews related to the intersection of human trafficking in healthcare that you can find in the published literature. Finally, we wanted to touch on other types of peer-reviewed research. There are many articles related to human trafficking in healthcare that are published in research journals but are not actually original research, where a research question was not asked and a research analysis was not performed. Journals generally publish these types of other articles, which include opinion or perspective pieces, advocacy pieces, and call to action pieces. When we discuss meaningful engagement, an important concept to discuss is community-engaged research, as meaningful engagement falls under this general topic. The first term in this space that you may encounter is community engaged research, sometimes abbreviated as CENR. This refers to research that involves individuals who broadly belong to the community that your research question is about or affects at any level. The term community-based participatory research, or CBPR, is a more structured form of community-engaged research. CBPR involves individuals belonging to the community affected by the research from the very beginning, from the conception of the research topic and question all the way to data analysis and publishing of results. All forms of community-engaged research may involve a community advisory board, or CAB, which consists of individuals who identify with the relevant community. The CAB provides important input depending on the level of engagement, which we will talk about in detail shortly. A best practice is to provide compensation for their time and work products. The usual steps in the research process involves first designing the study and deciding on research questions, then obtaining institutional review board approval if applicable, and submitting grant funding applications. After this step, the study is implemented and data is collected. Data is then analyzed and submitted as a research manuscript for publication. This slide shows how steps in the traditional research process can be modified to include meaningful engagement of experts with lived experience. The highest level would be to involve experts with lived experience during the very first step of developing a research question. This is a stage where a community advisory board can be planned and incorporated into the study team. An important modification of the next step is to consider meaningful engagement when writing grant budgets. Study implementation, data collection, and data analysis can all be undertaken with input from the community advisory board members. Writing manuscripts and publication can be modified to include co-authorship or, at the very least, acknowledgement of advisory board members. It is important that authors adhere to the ethical guidelines outlined by the journals about who qualifies as an author and be transparent about this with your advisory board. This will overall depend on the level of engagement chosen by experts and researchers. Finally, two important modifications to this process at the end include considering disseminating research findings outside of peer-reviewed journals, which would include policy briefs, reports, toolkits, social media campaigns, blogs, etc., which we will go into more detail later. Researchers should discuss what forms of dissemination are most meaningful to experts. Finally, researchers should consider meaningful engagement in planning next steps and follow-up research, which cycles back to the beginning of this process.
Nothing about us without us is a slogan used to communicate the idea that no policy should be decided by any representative without the full and direct participation of members of the group or groups affected by that policy. This quote is a paradigm through which I will ask you to keep in mind when learning about ethically and meaningfully engaging survivors in your work. When it comes to compensating survivors fairly for our time, expertise, and skill sets, it's important to not do so in a tokenizing way. In this specific context, it's helpful to treat us like you would any other hired subject matter expert or consultant, and to not hire us from a place of seeking a rubber stamp of approval, but rather because you genuinely value what we have to offer in the work. It's also important to have open communication about what payment will be and how long it may take to receive, especially for survivors who are new to this work and may not realize that sometimes grant money or other consulting or contracting payments sometimes take longer to process or be paid out.
As a researcher, there are many considerations when building a budget. Budgets generally need to be made well in advance of carrying out a project, which gives the researcher time to identify collaborators, but can also be difficult if the researcher does not have funds to allow for compensating partners for their time to comment on a responsible budget in advance. Most research grants are reviewed by professionals without any experience in your field. We therefore recommend using existing resources developed by survivor-led organizations to convey to the funder and the reviewers why it is so important to both involve and adequately compensate experts with lived experience in your work, and to add in extra information about this in your budget description to make your points. Consider not only budgeting time for meetings, but also for the preparation time beforehand and for professional development activities for your collaborators.
Best practices for meaningful engagement guidelines include things like creating a respectful and mutually supportive partnership that doesn't feel tokenizing, as well as setting expectations, roles, and responsibilities for the partnership up front. Also, ask survivors what their rates are instead of assuming. As far as language, respect individual preferences for terminology, such as survivor or victim or person with lived experience, etc. The best way to find out what language an individual prefers surrounding their own experiences is to ask them. Also, remember to share decision-making power. Awareness and open discussion of power dynamics, the elephant in the room, is important. As far as mutual benefit and learning, both survivors and researchers can learn from each other, and it's important to keep that in mind that it's not one-sided. It's also crucial to inform lived experience participants of risks of participation, trigger warnings, and how to provide supports for re-traumatization, including supports beyond just providing hotline numbers, etc. It's also helpful to provide resources for individuals on the study team, such as surveys and toolkits or worksheets to determine which strategies to use. The possibilities for work products created in meaningful collaboration with people with lived experience are vast. This includes but is not limited to policy briefs, toolkits, blog posts, social media campaigns, listening sessions, and publications written, reviewed, and/or edited by survivors. In the next slide, I'm going to go over 3 different work products I helped create or work on as a survivor, collaborator, and consultant. The 3 examples of work products I'm going to highlight are a toolkit, a publication, and a research study. The first one, called the Meaningful Engagement of People with Lived Experience Toolkit, is something I will be referencing again in the following slides multiple times. This toolkit centers around a really helpful tool called the Lived Experience Engagement Spectrum, which helps guide researchers, organizations, and institutions in meaningful and ethical engagement. The Digital Footprint Project, a research study, is another one I will be revisiting and going more into depth about shortly because I will be presenting it as a case study. The public health document I was one of the co-authors and reviewers on was Care, Self-Determination, and Safety, a community-centered public health approach to preventing human trafficking. The 5 levels in the lived experience engagement spectrum, beginning with the lowest level, are inform, ask, involve, collaborate, and empower. The examples to follow are quoted directly from the Meaningful Engagement of People with Lived Experience Toolkit. To involve, which is the lowest level of engagement and not considered survivor leadership at all, means to keep people with lived experience informed about decisions that impact them. An appropriate example of this would be to make sure current survivor clients know how to find information, policies, and services that impact them. To ask means to seek out and review feedback from people with lived experience and to incorporate that feedback when possible. An appropriate example of this would be to ask survivors to review and give feedback on an existing document when a complete rehaul of the document is not appropriate or accessible. To involve means to work with the impacted people throughout planning and implementation to consider their concerns. An appropriate example of this would be hiring survivors to review grant proposals or development proposals. To collaborate means to work directly with people who have lived experience on each aspect of program development and implementation, from exploring options to making financial decisions. An appropriate example of this would be when survivors are given choices about the kind of jobs they can do and are well supported in pursuing the kind of leadership they would like to engage in. To empower, which is the highest level of engagement, means that you will leave final decision-making power to people with lived experience, and they will be the ones to implement the strategies and decisions they develop. An appropriate example of this would be hiring survivors for their skills rather than just their trauma, and supporting them in leadership development. As we talked about earlier, community-engaged research would be closer to the lower levels of involve, ask, or inform, while community-based participatory research would be an example of the higher levels of collaborate or empower. One thing to keep in mind is that it isn't necessarily the best thing to try to jump to the highest level of engagement immediately. There are a variety of contexts in which this may not be appropriate and could even actively cause harm, such as if a survivor is thrown into a role they have not been adequately prepared for or supported in. Now we are going to talk about a couple case studies of successful projects with meaningful engagement. Now I will be revisiting the Digital Footprint Project. A modification of the quote of mine pictured here that is on the study website would be, "It is crucial for researchers, healthcare workers, and organizations to understand how to ethically and meaningfully engage survivors in research or work that impacts us or is about us." A brief summary of the Digital Footprint Project is as follows. Much of what we know about sexual violence has not yet considered the role of technology and social media. In the last decade, several accounts of sexual violence that have included non-consensual recordings and videos that are distributed online have emerged. Victimization experiences now include a public witnessing and a digital archiving of abuse, but current legal protections often leave survivors with little recourse or support to remove their images from the internet. An understudied phenomenon, this three-part study includes Study 1, a media analysis of DDSV cases, including the development of a novel database. Study 2, written and verbal interviews with stakeholders and subject matter experts. Study 3, written and verbal interviews with survivors who have a lived experience of DDSV. There are so many things that made my participation in this project a positive experience. Some of those things include that it was true to trauma-informed principles and best practice, and myself and the other survivor consultants were compensated fairly for our time, expertise, and lived experience insight. It also felt safe to give honest feedback every step of the way to help guide ethics, and accessibility was very clearly a big priority, and that was reflected through every step of the process. We also helped create and have ongoing access to a document full of helpful tips for consultants and other participants to manage potential triggers, aside from just advising to call a hotline, which many survivors do not feel safe to do or helped by doing. Many survivors feel unsafe calling hotlines because many either report directly or pressure survivors to report to law enforcement, including ICE, which can be dangerous for undocumented survivors.
Our second case study is on a quantitative research project that I am undertaking. This project is looking at information from a large national database on pediatric emergency departments to understand how socioeconomic factors such as Child Opportunity Index relate to healthcare utilization amongst children who were identified to have experienced human trafficking. I assembled a community advisory board of 2 professionals with lived experience of human trafficking with the collaboration of the National Survivor Network. Because it took me a while to receive funding, I was able to involve the community advisory board after the research question and analysis was finished. Therefore, the advisory board will be acknowledged for providing high-level comment on the results, but they will also lead and first author creation of policy briefs and infographics related to the results of this research. The budget was built to compensate them for meetings, creating the work product, and professional development.
In conclusion, remember to consider meaningful engagement at the start of study planning and build meaningful engagement into research funding budgets. This will help create mutually beneficial work products. Also, actively consider how to create a respectful partnership and keep that goal in mind throughout the work, not just at the beginning or the end.
Rose and I have created worksheets based on this presentation to assist both experts and professionals in navigating the meaningful engagement in healthcare research projects. These handouts will be available to all attendees. We would also like to point out that while there are separate handouts for researchers and experts, we acknowledge that these groups are not mutually exclusive and may overlap.
Thank you so much for attending our presentation. We truly appreciate your time and attention. Here are our citations for this presentation, as well as some helpful resources. Thank you again.